And good morning, and thank you for joining us today. My name is Jessica Seafried, and I'm a director here at the National Minority Cardiovascular Alliance, where we are thrilled to be introducing eCARDIO Hub today. A few quick notes of housekeeping before we dive in. We are recording today's webinar so that we can post this as a resource within the Hub. And the agenda today is brief. We'll provide an overview of the organization, provide a tour of the Hub, and then open the floor to any questions or suggestions. You are all on mute right now, but the chat feature is enabled, so please feel free to chime in there. So without further ado, I'd like to turn the program over to Sarah Lincoln, a founding board member of the Make Well Known Foundation. Today, Sarah will be providing an overview of the foundation and its major initiative, the National Minority Cardiovascular Alliance. Sarah, welcome to the webinar.
Excellent. Thank you so much, Jessica, for that warm welcome. And thank you all for joining from your desks or home offices around the country. As Jessica mentioned, my name is Sarah Lincoln, and I have the distinct pleasure of helping to introduce this exciting new resource today, the eCARDIO Hub. By day, I serve as a senior director at a healthcare services company that specializes in patient engagement. But more specifically, I have been on the board for Make Well Known Foundation since its inception. And Jessica, if you want to go ahead and advance the slide. I think many of you may already be familiar with the Make Well Known Foundation, but by way of refresher, we are a 501c3 charitable organization, and we collaborate with a range of different stakeholders to activate solution-oriented initiatives that reach into at-risk communities to empower people to cultivate better health. And there is a specific focus on minority and underserved communities in all of the work that we do. You want to go ahead to the next slide? So I'll dive in. And what you'll see on the page that describes the National Minority Cardiovascular Alliance is really what the Make Well Known Foundation's work translates to in terms of initiatives. And the National Minority Cardiovascular Alliance has certainly been the brains and energy behind the eCARDIO Hub. You'll see the NMCA Alliance's focus and specific patient communities here on the screen. Current strategies for supporting these communities include increasing access and awareness of subgroup data, taking a look at diversity in clinical trials, and addressing various access to care issues. Some of the ongoing programs in each of these areas can be seen in the colored boxes along the bottom. So in red, the Cardiovascular Patient Experience Survey was developed to step beyond what was available in general data to gather more specifics about the experiences of minority patients who are receiving cardiovascular care. There's actually a publication that's coming out soon for this effort, so keep an eye out for that. The NMC Alliance is also conducting an ancillary study with NHLBI's Study of Latinos, that's the box in blue, to better understand biomarkers that are specific to dyslipidemia and Hispanic and Latino subgroup populations. We're looking forward to sharing findings from this study later this year. In green, the masterclass on dyslipidemia will actually be online later this month. This is a clinician training program that combines feedback from clinicians and patients to inform effective conversations with minority patients to support better outcomes. And then finally in orange, we have the eCARDIO Hub, which is what we're all here to talk about today. And we're so grateful to those who have been instrumental in getting this project up and off the ground. That includes our steering committee members, our board members, sponsors, and especially our very busy interns. And I know many of them are on the call on the webinar today. So without further ado, Jessica, if you want to advance to the next slide, we can talk a little bit more about the eCARDIO Hub.
Great.
And at its heart, the eCARDIO Hub creates a tangible and interactive online space to get and disseminate information and to identify collaboration opportunities, a kind of digital destination for all things related to minority cardiovascular health. The features that you'll see include a search engine where you can sort by keyword, data type, or specific population group. and more. Some other features that we'll walk through are an ability to add and search relevant organizations, and a way to submit work or references to be included in the database. The eCARDIO Hub is growing daily and contains a diverse set of materials that we believe can be utilized by multiple sectors. It's launching with a vision of linking stakeholders with information and with connections that can be used in meaningful ways in our day-to-day work. For example, our partners in advocacy may benefit from access to more granular data that comes out of recent surveys and studies. Our industry partners can search for advocacy organizations or researchers to engage for upcoming presentations or projects. And our researchers and communications professionals can make new connections with peers in this space or review recent relevant studies. The eCARDIO Hub will continue to grow more vibrant with input from all of our different stakeholders and partners. And Jessica will get more to this in a moment. But please make sure that you are adding your relevant work and creating an individual organizational profile so that others can find you. And I think with that, Jessica, I will turn it over back to you.
Thanks so much for that overview, Sarah. I'm going to take you all on a quick tour of the website, which can be accessed from ecardiohub.makewellknown.org, or you can enter through our webpage under current projects. So eCARDIO Hub can be used and searched through via a number of ways. So for example, just like any other library search engine, you can use our search bar. So as an example, we're going to use COVID today. So I would type in COVID, click search, and you can see here all of our relevant articles, relevant meaning relating to minority health or minority cardiovascular health will show up here. So that's one way you can access. And if you click back here on eCARDIO Hub, it will always take you back to the home screen. So if you're not quite sure what you're looking for, or you're just sort of exploring, you can click here to enter eCARDIO Hub. And here we have the categories that are currently loaded into the hub. And as Sarah mentioned, we are grateful to all of you who will hopefully continue to add to the hub to make it more robust. And that is certainly something that we work through every single day. So again, if we were looking at COVID, we can check COVID, apply, and here they will be sorted through in alphabetical order. So if we go back to the home page, that's an overview of how to look for literature, data, presentations, and the like. And as we keep mentioning, we really hope that all of our users will add their content and their hard work in this relevant space to the hub. So you would do so by clicking this button, Suggest Content, entering some brief information, either upload or provide a link, preferably a DOI link, and then submit. And so this will then send a nudge to us. We'll review it, make sure it's relevant, and then it will officially become part of the hub. So there will be a little bit of a lag there between when you enter it and when you see it pop up within the hub. So that is how you'll add your content. The other feature that Sarah talked about is organizational profiles. So here we can view them, and here we can add our own. So if we're looking at current organizational profiles that we've added in, and we have simply started by adding in our steering committee member organizations. So for example, if we're looking at policy organizations, we'll see ASTO and PATCH here. And if you were to click on one of them, it would take you to their webpage. And here, this, how much you are entering in about your organization is going to vary. So we'll see different levels of information here. And so we hope that you will provide as much information so that those looking at the content can really get a feel of your organization and see if a collaboration opportunity can arise, or just really learn more about what you're working on. So in terms of how to add your profile, you again go to create organization profile, and just like the content suggestion, you'll fill in a couple of things here, check what type of organization you are, and submit. And again, this will come to us, we'll approve it, and then that information will live on the eCARDIO Hub. And as this is growing and becoming more robust of a tool, up here you'll probably see us highlighting right now. Obviously everything is about COVID, so we'll put in either new content or relevant content here, and again this would take you back to the COVID information. So that is a bit about that. We tried to make it as user-friendly as possible. We tried to include as much as we could. And so now I really would love to open the floor to any thoughts, suggestions, questions about the hub, about how to use it, anything like that, because this is something that we are able to make edits going forward. So we really appreciate your thoughts. We do have the chat feature open. All right, first question. Question about what type of content would we like to be included in the suggest content page? And I think that's really, the answer is as broad as possible. So we have, right now it's very heavy on academic journals, but we want to make sure that any relevant presentations, whether it's an abstract or it's a PowerPoint presentation, a PDF that you've developed, that gets in there. Lay press articles, your data sources, open access data, clinical trial data. I think the answer to that question is anything that you feel is relevant and helpful to someone working in the minority cardiovascular space. Any other questions or suggestions? All right. Well, then I would like to turn it back over to Sarah for some closing thoughts.
Great, thank you so much, Jess. So as Jess said, again, the link to the eCARDIO Hub is going to be made available, and we hope this resource is more valuable than ever, especially in these turbulent times. And we also hope that you have an opportunity very soon to get into the Hub and begin to share and collaborate. So I will make a final friendly reminder about making sure to get in to submit your work and individual organizational profile if it's not in there already. And before we let you go, we also just want to extend a final word of thanks to the incredible members of the broader Alliance family who have helped bring the eCARDIO Hub to life, really. That includes my fellow board members, the NMCA Alliance partners, the NMCA Alliance staff, and our very generous sponsors. To you and all of those joining the Zoom this afternoon, thank you for your combined efforts to advance the cause of cardiovascular health for all populations, and happy exploring Cardio Hub.
Thank you so much, Sarah. And we had one more question come in about getting a copy of this presentation. And yes, absolutely, we'll be posting the recording of this presentation on the Hub for access going forward on any tips and tricks on how to use the Hub. So thank you so much, Sarah. Thank you to our sponsors. Thank you to everyone who was able to join us today. And we look forward to seeing you on the Hub. All right, have a great day, everyone.